And that means the recording will turn on. Right, Sanasa? Yes.
Yes, supposed to, yeah.
Yeah.
Oh, I think Paul used my registration link. That's probably why he comes up as with my name. Just letting you know.
That's okay. Welcome and thank you to the folks who have come on early. We are going to give it until 12:01 and we're going to start promptly at 12:01. We will be recording the webinar. We'll be sending out the recording with a copy of the PowerPoint, as well as a list of resources, sometime hopefully tomorrow, possibly Friday. So just so you know that if you have to leave in the middle of it, or if you just wanted to review some information, you'll be able to do it. Welcome, everyone. We are going to start the webinar at 12:01. We have a lot of content today. I thank you for coming on early, so just sit tight and we'll begin shortly. Welcome, everyone, to New York City Emergency Management Heat Safety and Preparedness webinar today. A few housekeeping things before I start to advance the slides. We are joined by the Health Department, Con Edison, and also from the Human Services Department here at NYCM. So we have a lot of content for you. Want to just get that out ahead of time. We are not going to be posting any links in the chat because they are too many to post in the chat or in the Q&A. We would like you to hold your questions to the end. So if you could just jot down your questions for the individual presenters at that point. We are hoping to get through quite a few bits of information and want to leave time for some questions and answers at the end. If you could use the Q&A function, that would be amazing, because that way we can just make sure that we get those questions noted by Sanasa, who is helping me as a co-host today. And to start off, I just want to talk about this cover slide, which has a beautiful picture of Manhattan at night lit up with the sky in the background, describing our webinar.
Jill, before you move on, can you fully share the slide? We can see the other side of it as well.
Oh, sorry about that.
Mm-hmm.
How about that? Is that better, Sanasa?
Oh, no, it's still the same.
That's strange. I think I have, sorry, folks, I'm just going to have to stop the share for a second and just try it again. Ah, Sanasa, I'm so sorry.
It's okay. Take your time.
Are you seeing anything yet? No, right, because I'm not sharing anything yet.
Yeah, nothing yet. You're all set.
Great. Okay. Sorry about that. Moving right along. Just going to go over the agenda real quickly. We're going to look at heat in New York City. After a brief explanation of some warnings and what we do at NYCM, Kat from DOHMH is going to start off with the safety and heat health, followed by Con Edison, followed by me presenting some of the heat cooling assistance information. Once again, all that information will be provided as in a Word document as resources post-webinar. Then Jocelyn will present what we do during heat season, including new NYC cool options and the cooling centers, and then we'll close out with some emergency notification updates from NYCM. What we do and who we are, we help New Yorkers before, during, and after emergencies through preparedness, education, and response. The image on the left is of our building at 165 Cadman Plaza East. This is, if you want to get into the weeds here, this is how the National Weather Service breaks down heat waves and advisories and heat watch. This is important to know what is coming down the pike. And we'll just go over it real quickly. Heat wave is at least 3 consecutive days with high temperatures of at least 90 degrees. An advisory lets us know it's coming, and we send that out 48 hours in advance when there's pretty much 80% forecast confidence that we're going to get the following conditions: either excessive heat watch, and that comes 24 to 48 hours in advance, or an excessive heat warning, and that comes 24 hours in advance. And these are all extremely hazardous conditions. And Kat, we're going to kick it right over to you. Thanks.
Good morning, everyone. My name is Kat. I'm from the Department of Health. And yes, I'm from the team that is called the Environmental Surveillance and Policy. We focus on really looking at how and to what extent does climate events, specifically extreme temperatures and flooding and energy insecurity and green space access, to what extent does it affect our health? So I am going to be showing you our work, and I hope that you find it interesting and something resonates with you to take action in your communities and take care of your families. And if you have any questions, we can chat at the end. So let's kick it off. So for this presentation, we're going to have a look at what makes New York City so hot. What is it about the built environment that then affects us and our health? So we're going to be talking about that. And then afterwards, we're going to specifically look at heat risk factors. And then I think the most important part of this presentation is how to spot heat illness, because heat illness, in terms of heat exhaustion, you can take action in helping save someone's life. So I want to be sure that you're equipped to spot it when you see it. And then finally, we'll end with some community level strategies and resources on what to tell people, what are the resources out there. However, this whole event has some incredible speakers with a lot of information, so they will kick it off and take that message further. So we can keep going, please. Yes, so extreme heat in New York City is deadly, and these deaths have been increasing over the past decade. It is the #1 weather-related cause of death in the United States and New York City. This number was actually 250, but now it's more than 500 New Yorkers die prematurely each year due to extreme heat. And most of these deaths are on days that are hot, but not extreme heat. What we mean by that is that there are neighborhoods that these deaths are not equitably distributed. And so while all New Yorkers are susceptible to heat illness, there are neighborhoods that are more susceptible than others due to urban planning in past decades. And because of that, since there is not enough green space or access to it, amongst access to air conditioning, different factors we'll talk about later, as a result, in a certain neighborhoods, and I'll show you in the presentation, it only has to be 82 degrees to feel those impacts to then feel a heat illness. It doesn't necessarily just have to be a heat wave. Definitely a heat wave, you need to be on alert, of course, but that's just for you to be aware and to bring that information back. So we can keep going. So what is urban heat island effect? Just to go over, on the left image here, what we have is a graph that has two colors. So the first color is surface temperature, which is in red, and then blue is looking at surface temperature at nighttime. So let's start with blue. So what we see here is that we have a city, which is right in the middle, downtown, and as it moves outward, it's looking at suburban, rural. And so what this is essentially saying is that heat gets trapped in the sense that when there's more presence of pavement, of surfaces that are not natural, that do not have trees, that do not have soil to absorb that heat, it can stay well into the nighttime. So that's why you see on the red lines here, there's such a big difference. What that means is that, yes, it's getting hotter, because you don't have that presence of green space, but it's staying there because that cement is absorbing it. And so you can feel those effects for days on end. And we feel it in the summertime. And then what we see with the nighttime here is that, yes, it gets warm, but when you have more presence of green space, you feel those effects less. So it's just overall talking about urban heat island effect in terms of trapping that heat, but also the importance of green space, which you see in the thermal imagery here on the right side. So we can keep going, please. Yes, so as I mentioned earlier, there are, what we look at is heat vulnerability index in my team. And so what constitutes a heat vulnerability index, essentially, how we get to an image like this, is that we look at green space, like we saw in the previous graph. They play a humongous important role, because when you have such a dense amount of cement, of parking lots, of just pavement, of buildings, just surfaces that trap that heat, and you don't have the trees to break that up, that can present oven-like conditions, trappings, and that will affect your body temperature. And if you have a chronic condition, that will be a problem. So green space plays a very big role. Surface temperature, as well, as we saw in the previous graph, but also what goes into this work is air conditioning ownership. That's the #1 prevention that you can do to not get heat illness, but also if you have heat exhaustion, that's the #1 prevention to cool yourself down. So, and what goes into that? Median income. So electricity bills are high. They're very high, and not all of us can pay them on time or able to. So that goes into an equity issue looking at this. And so what this map means overall is that, again, all New Yorkers, all Americans can feel the effects of heat. However, in the areas that you see in red and orange, in those neighborhoods, it only has to really be 82 degrees to feel that and start if you have a health condition problem. So that's, we can go on to the next slide, please. And so this is just breaking it down further because I've mentioned a few times about it affecting if you have a chronic health condition. So in my team, what they looked at was 59 death records of people. Oh, we'll go to the previous slide. Really, wait, two back. That one, yes, thank you. So they looked at the death records specifically of folks who didn't necessarily die of a heat stroke or heat exhaustion, but like indirectly died. So what does that mean? It means that they had a medical characteristic listed here that when they entered into the heat, it then exacerbated their condition to which they passed away. So this is indirect death. And what they found is that the folks who have passed on had one or more chronic condition, evidence of cardiovascular disease, evidence of alcohol and substance abuse, or evidence of schizophrenia, cognitive or psychiatric condition, history of diabetes. All of these can be exacerbated during extreme temperatures. So I just wanted to put this on your radar because this is research that we published and we want all of you to know that. So we can go on to the next slide. So yes, not having or using AC at home, it's the greatest risk, absolutely. But it also, like we saw on the previous chart from our findings, is that the risk increases with these conditions. So not having AC, absolutely. Limited mobility as well. So when you have limited mobility, you're not able to get to cool spaces. So if your neighbor, friend, or family member has limited mobility, check on them during hot weather. And if possible, find them a safe place to stay until the weather cools down. And getting to cooling centers can be challenging if you have limited mobility. So see if your local transportation authority or even organization offers free rides for qualified individuals. Ask them if they have a plan to get to a cool space. Where will they go? So that's very important because they are at risk. Also those who have substance abuse or substance use that can also exacerbate during heat waves because alcohol or even hangovers can make you more at risk of dehydration, and stimulants such as methamphetamine can increase your risk of dangerous overheating. So I would say use buddy system, look out for others who may be partaking in drugs or alcohol during hot temperatures in the summertime, and try to find a safe space to cool down. So that was also important. In terms of chronic health conditions, yes, I would say I mentioned like diabetes in the previous slide. It could be from like not high temperature essentially changes how the body uses insulin. And so not drinking enough liquid can raise your blood sugar. So that can cause you to urinate more and cause dehydration, and then thus, heat exhaustion or heat stroke. So it's important to drink plenty of water, even if you're not thirsty. Avoid alcohol or drinks with caffeine that can lead to water loss and spikes in blood sugar. Check your blood sugar before, during, and after if you're active, and definitely check with your doctor if you may need to change or increase your insulin use. And definitely, of course, wear sunscreen and a hat when outside because sunburn can increase blood sugar levels. So that's giving one example of a chronic health condition. So definitely check with your medical provider, absolutely, about your case. Or if you're in any of these situations, or if you know people who just understand that like they are at risk. So we have to go to the next slide, sorry. Thank you. So yes, AC is the #1 prevention for heat illness. Most deaths are in homes without an AC unit or the AC was turned off. And indoors can be much hotter than outside. And homes can stay hotter for up to 3 days after a heat wave. And understand that fans alone are not enough in very hot weather. Indoors specifically, if it's over 90 degrees, that can be a dangerous condition to which you would need to have a plan to stay with a relative, stay nearby, find a cool place to cool down. Yes, absolutely. So we can go to the next slide. So this is a checklist I'd love to share. It's from the CDC, and it's for spotting heat illness to intervene. It could even be a self checklist, like to, ask yourself, are you okay? It can be an observation type of questions if you're out and about and you want to keep your community safe. So question number one, are they drinking enough water? Number two, do they have access to air conditioning? Number three, do they know how to keep cool? And number four, are they showing signs of heat stress? So we can move on to the next slide. And just going over again who's susceptible, I mean, it's a whole community approach. Definitely, absolutely, older adults are very at risk, but also there are folks who are homeless that are also at risk due to that lack of access to be able to hydrate or even find shade or find air conditioning that make them susceptible. For older adults, they can have difficulty staying cool during hot weather due to that body regulation. And mobility, we talked about that in the previous slide, or even athletes, or if you have a chronic health condition and you like to train for a sport, be aware that you may be at risk. Really check on your hydration during that time. And also, I'm trying to think, oh yeah, if you're outside, definitely. Yeah, because you are out there, and especially certain times of the day from 10 to 4, that can increase your risk for heat illness. So we can move on to the next slide, since I think we will need to understand what is the difference here, right? So heat stroke, well, I'll talk about heat stroke first, and then we can go to heat exhaustion. So a heat stroke essentially is when you're having a throbbing headache. Depending on your health condition, you may not show signs of sweating. So that, for instance, if you have like a spinal cord injury like that, you may not, that's going to affect your body's ability to sweat. Or if you're wearing tight clothes like that are just to your body and maybe it's a dark color, that can also affect your sweating pattern as well. Also, you can have a body temperature above 103 or just like feverish type symptoms. Nausea or vomiting will be very intense, a rapid, strong pulse. These are all a big problem. So you definitely need to call 911. If you see that happening, move the person to a cooler area, loosen up the clothing, remove the extra layers that's like trapping that body's ability to sweat, and definitely cool with water or ice. Absolutely. For heat exhaustion, you can intervene. What happens, or like the signs, is that someone will either say it, or maybe you notice that they're, faint, perhaps dizzy, excessive sweating, definitely pale, clammy skin, nausea or vomiting, that could happen. Also rapid, but then a weak pulse. That can also be heat exhaustion as well. If you're an outdoor worker or if you're an athlete in particular, you may feel muscle cramps. That's a sign of heat exhaustion. That's a sign that you need to you need to cool down, you got to chill. But if you're an athlete, but like if you see someone going through this, definitely get them to an air conditioned space or get them somewhere cooler, and drink water until fully conscious, and take a cool shower, or even use a cold compress or towel. But I'll get into the next slide here. Yes, so if you notice these signs specifically, what you will do, move them to a cool place in an air condition, like where their body can go through that process of releasing that internal heat. And so, yes, encourage them to drink gradually so that way they don't choke or, nothing like that. And then also you want to make sure that they're lying down, and you want to like lift up their knees a little bit, have them relax, and then if necessary, loosen or remove heavy clothing to let that body release the heat. And if you want to hurry up that process, although it takes some time, you definitely want to grab a cool compress, or if it needs to be makeshift, maybe a towel, put in cold water, put it on their forehead and under the armpits. That will help. And then, yeah, just observe their conditions. And after administering first aid, I will say this isn't something that's probably going to work within like 10 minutes. Like it may take like up to an hour for that person to calm and cool off. So, but if you notice these symptoms don't improve, or if they're getting worse, like the heat stroke type of symptoms, yeah, call 911, definitely. So this was some first aid. So we can move on to the next slide, please. Yes, so drink more water than usual. Don't wait until you're thirsty. Definitely check for that urine color. Make sure it's clear. And reapply sunscreen if you're working outdoors. Something that's lightweight, light colored, ideally cotton, that can allow your skin to breathe. And if you're an outdoor worker, maybe long sleeved to protect yourself from the sun. Definitely wear a brimmed hat. We can move on to the next slide. Fans alone will not provide enough cooling when it's very hot outside. Yes, as I mentioned, if your indoor temperature is like really, really hot, like 90 degrees and over, that can be dangerous. So that fans alone will not help in that instance. But otherwise, yes, ideally you just want a cool space, and definitely take showers or baths throughout the day. Avoid alcohol or liquids with large amounts of sugar. Anything that can affect your hydration, just you want to be mindful of. So we can go to the next slide. I was about to mention the previous slide, so I knew it was going to show up. So yeah, definitely use your stove or oven less to maintain a cooler temperature in your house. Don't allow for that extra trapping of the heat. And heavy sweating can remove salt and minerals from your body. So definitely consult your doctor about how to safely replace salt and minerals lost throughout sweating. So yeah, specifically if you are pregnant and expecting, your body's working extra. So definitely be mindful of this particular point. And if you're working, if you're an outdoor worker, if you know somebody in this situation, ask, or if you're just not monitoring, if you're supervising a team that's going to be outside or tabling, maybe, be mindful, from 12 to 4. And if it's a heat wave, definitely be careful and see if anything can be scheduled or revised, or just encourage frequent hydration, take breaks in the shade or in a cooler space to ensure the safety of your team, of your family, of your community. So we can keep going. Thank you. So yes, if you're planning for an event, encourage hydration, ideally with non-alcoholic beverages, to help with hydration, but also in the case that maybe you need first aid, that will come in handy. Also provide shade or misting tents, definitely. Ready cooling towels or ice packs just in case, and to be preventative and provide free water to attendees. Why not, right? I would also say, if possible, I didn't mention it in the first aid, but like if certain fruits can help too, if you want like apples or bananas or anything with vitamin C that can help that process of cooling down. Also, for tips for day of, sip water throughout the day, even if you're not feeling thirsty, go for it. It's extreme temperatures, so we have to be careful. Take frequent breaks, limit exercise or activities during prolonged heat exposure, watch out for signs of heat illness, and take action. So we can move on. Yes, we're going to encourage community members to sign up for HEAP, but we're going to talk about that in other presentations. Stay hydrated, be vigilant for the signs of heat illness, and strike up a conversation. And just some examples of some swag and to hand out to people to get people informed of heat illness and community preparedness. Can move on to the next slide. And yeah, just to go over, being in an air-conditioned place is the best protection from the heat, especially those at greatest risk of heat illness. I did mention a lot of different chronic conditions or factors, that will be included in the resources for you to have a look and get informed and to make a plan. So definitely communicate about who is most at risk and how to prevent heat illness, because we may receive warnings about heat waves, but sometimes we don't understand the dangers of what that means for us and our situation. So it's good to always be informed. And I think that's it. I believe so, right?
One more slide.
Oh, this was one more. Okay, yeah, that's fine. So this is an example of a resource we put out for community organizations in different languages if you want to put a message out there about specifically health and heat. And so definitely if you want to use it for your social media or your group text or any sort of outlets that works for your community, we have this resource available for all of you to help check on family, neighbors, and friends, make sure they're safe and cool, encourage them to use AC, make sure they're hydrating, be alert for those signs of heat illness and what to do, and alert people at risk to definitely talk to their healthcare providers and make a plan. Ask those questions. If you have a child, ask their teacher, ask their coach, just really include people and make sure that we're all ready. So thank you for your time.
Thank you, Kat. Sorry about that. And
Thanks,
now
Jill.
we're gonna, that was great. And I just want to echo what Kat said. You're going to hear the strong message about encouraging your neighbors to apply for the heat cooling assistance benefit now. And I'll be getting into more details about that shortly. But right now we have Con Edison to present on financial assistance programs.
Hi, everyone. How are you doing today? My name is Kalila. I'm from Con Edison's Customer Outreach and Education. So we're just here really to share about some ways to ease our customers' energy burden. We understand that, as Kat mentioned, we need the air conditioners, and sometimes, unfortunately, some need more than others. And safety's first, but here are some ways that we can help with potentially some customers are eligible for these financial assistance programs. So you may have heard of this one before, but if you haven't, this is our Energy Affordability Program, also known as the Low Income Discount Program. It is based on customers who do receive certain qualifying governmental assistance programs. We have a list of it on our website along with the form to register. In terms of the enrollment, there are some that are already automatically enrolled. Some customers may already see it on their bill, on the first page of their bill. They'll notice a credit and a little note saying why they're receiving this credit, this monthly credit. But there are also other programs such as Medicaid. If you receive Medicaid, that is a self-enrollment process. And what that means is if you do qualify, but you don't have that credit or you're not on that program, as indicated on your bill, you can go ahead and register for that so that you can receive some kind of relief on your monthly bills for your electric and gas. Next page, next slide. So in regards to the self-enrollment, you can visit our website at coned.com/EAP and provide the documentations. You can email it to us at eap@coned.com. You could also fax it, mail it. You could go to one of our walk-in centers and provide the documentation. The most important thing, along with your Con Edison account number or even the bill, just so that the account number is on it, is the award letter, the benefit award letter, or the budget letter that indicates whichever document, whichever program you're qualified for. For example, if you have SNAP, you can provide the award letter or the budget letter that indicates your name, your address, and also the time frame in which you're qualified. So with that information, you could provide it when registering with us. Next slide, please. So here's a list. It's take a snippet if you need, like take a screenshot or whatever that's needed. This is the breakdown and the tiers for how much you would get depending on the qualifying government assistance that you have. So it does vary based on whether you have electric, gas cooking, or gas heating. Next slide. And we also have another program, which is a really good program that some may qualify for, is our Energy Share program. We work with an organization called HeartShare, and the grants actually recently went up to, it's up to $300 if you're eligible for our residential customers. And some of the eligibility requirements are as long as you've made one good faith payment towards your bill within the last 12 months, and you're eligible for a governmental financial assistance program or meet the federal HEAP income guidelines. So this is the way you can go ahead and apply for it. And you can contact HeartShare. They'll be able to assist you. You can also email them. Next slide, please. Now I'm going to go ahead and pass it off to my colleague, Paul, so that he can go ahead and share some of the energy saving tips with you.
Hi, everybody. Thank you, Kalila. Yes, my name is Paul. So we're just going to continue our theme, which is energy conservation, which at the end of the day is the best way to save. This is all also, by the way, available on our website at coned.com, CONED. So we're just going to go through some energy saving tips. So the first is lower your thermostat. And to get into more depth about that, I would say temperature in general is a great way to save. So try to avoid drastic temperature changes. For example, if your home is at 60 degrees, maybe don't turn it up to 75 right away. Maybe we turn it up to 65 and then gradually 68 and then to 70, because drastic temperature shifts make those appliances pull a lot more energy. So insulation is also key, but I believe I'll touch on that in a little bit. So just if you do have an air conditioner, try to set it to economy mode so that it shuts down when it reaches that certain temperature you want. And the same thing could be applied to heat, in the cold weather season as well. So the next is consider a cold wash. So that's something that we might not think about. I know I wash my clothes with the cold just so nothing shrinks, but it's also a great way to save when you can. Also a temperature-based theory. So just check the temperature and try to do cold washes when you can. The next is to make your refrigerator run more efficiently. So that's something that a lot of people don't think about. I certainly didn't before I worked for the company. You want to make sure, make sure the temperature is good. Make sure the seal when you close the door is working and there's no energy leak, because that would make the refrigerator run harder. We also want to make sure that it's not too full, okay? Because if you overpack, you jam pack your fridge, right? You could barely close it. That's a lot of items to keep cold. So you want to make sure, if possible, that there's just a little spacing and make sure that it's not overpacked. And lastly, when it comes to the refrigerator, you want to make sure that the coils are clean. Sometimes, we can't really clean. We clean out our fridge, but we don't do that detail of a clean. But if you make sure that the coils are cleaned, they're going to be running more efficiently. Same thing. It's the same concept as cleaning the filter, right, in your air conditioner. So you want to just make sure that those coils are cleaned and you're getting good airflow. The one on the bottom left, keep ducts and vents clean. So that's true. You want to make sure everything's clean, and even more so, you want to make sure that you have good insulation. So it can be something, maybe a certain part of the house is drafty, or there's a window that's not fully sealed. Same thing with ducts and vents. You make sure you have good airflow. You want to make sure you have good insulation. So whether you're trying to cool your house or heat your house, you want to make sure that air is not leaking out, because those appliances are going to work harder to get that temperature. So if there's bad insulation, you can be running appliances and you're not getting that full effect. Okay. So next one, swap out your shades seasonally. So this is a good one to keep in mind. So some shades, right, they're pretty thin and they allow a lot of light in. There's others that are much thicker and block out the sun. So when you think of the shades, also think of insulation. So the thicker the shades are, the more it'll keep the sun out, thus keeping the home from getting overheated. Same thing, to keeping it warm. I know a lot of times we like to keep the shades open to get that sunlight in, but oftentimes, especially if it's an apartment, something like that, it can really help heat up the home quicker. So it's just another form of insulation. So make sure you have the right shades for the season. And then lastly, we have to use your dishwasher wisely. So similar concept to the refrigerator, right? You don't want to overpack it if you can. Air dry when you can. Maybe don't use it for every wash if you don't have to, but certainly that can pull a lot of energy if you're using it a lot. So just another thing to be mindful of. Great, right on cue. So just a couple more saving tips so you can save on energy efficient products. So you can get up to $100 off just for being a Con Ed customer. So we have partnerships with Home Depot and Lowe's and Dollar Tree. So you just find that Con Ed Instant Discount sticker at a participating retailer, and you can get discounts on certain products. Again, they're all energy efficient related products. And there's a little graph on the left. So something like air conditioner covers, going down a pipe wrap, spray foam, weather stripping, all of those things are potential items you can get discounts on, and they help too. Weather stripping, for example, is good with insulation. So we can go to the next slide. Perfect. So bill management, plans and resources. So these are just a couple ways in which you did all of your energy efficient items and maybe the bill is still too high. So these are ways that we can assist you from our end. So first we have payment agreements. Okay, so we do work with customers, try to find suitable payment arrangements if you're unable to pay in full. We do have the option now, you can enroll in an agreement online. So again, I encourage you to use our website at coned.com, create a username and password. It take a minute or two, which is good to see a lot of things, but for one, to enroll in a payment agreement. And you can always also speak with a representative if you need maybe different terms, and we can certainly work with you, but it's always good to call. The second is payment extensions. So a little more cut and dry, but you will be eligible for an extension, certainly if you've never had one or if you've honored one in the past. We can help you out with an extension, usually up to 15 days, but just give us a call if you get to that situation. And then lastly is the budget billing plan. So it was formerly known as the level payment plan. Now it's referred to as the budget billing plan, which is really kind of a better indication of what it is. So it basically just breaks out your usage over the course of a year. So you would pay the same amount each month, and we look at it every 3 months to see if you're falling in line. The amount that we start you at is based on an average of your previous 12 months. So we do use your former history as at the amount that we start you at. So just to make one thing clear, it's not a one payment and I can use as much as I want. You are still going to pay for what you use, no more, no less. The only difference is we spread it out over the course of a month. So if you're the type of person where your bills are a lot higher in the summertime, you can kind of spread it out over the course of a year, and vice versa if your bills are higher in the wintertime. So that's it for us. Thank you so much for listening. And yeah, check our website if you have any questions.
Thank you so much. That was great. I didn't know a lot about the things that you offer to help with all the suggestions. So we really appreciate that. I'm going to get into the Home Energy Assistance Program. And this is the cooling assistance portion of it. It opened on April 15th. And the thing to note about the cooling assistance part of the Home Energy Assistance Program is that it's finite. When they run out of money, there's no more money. And it doesn't matter what your need level is, there's none. And so the message that HRA wanted us to pass on, and I'll say it again at the end, is that if you know someone who has the need for an air conditioner and hasn't gotten one in the last 5 years, please, please, please encourage them to make their application now. It's going to be a hot summer. We know it. Last summer was very hot. They ran out of money for the program. This is the time to really take that action and help your neighbor out. And to break it down a little bit more, I'm not going to go into all the details. Those will be in the resource guide. The main thing to know is to go to Access HRA. That is a one-stop shop for all this information, and they show you the income levels, what you require, but what it will give you if you're eligible is you can get one benefit per household to help purchase an air conditioner and for its installation. Okay, so again, if it can't be installed for whatever reason, they'll provide a fan. And now I'm going to pass it on to Jocelyn for the cool options overview.
Right. Good afternoon, everybody. My name is Jocelyn Rajabali, and I also work at New York City Emergency Management, coordinating New York City Cool Options and the Cooling Center program. So today I'm just going to give you all an overview I'm not going to spend too much time on this first slide because Kat already gave a really great overview about why cooling matters and how dangerous extreme heat is. But I just want to reiterate, New York City summers are getting hotter. Heat waves are lasting longer. Jill just mentioned last summer was very hot, and heat can be deadly for everyone. So please do not underestimate your risk for heat illness or your neighbors or your family or your friends. There are definitely groups that are more vulnerable to heat illness, as Kat mentioned, and as is listed on the slide here, but heat can be deadly for everyone. So what is New York City Cool Options? This is basically a network of cool spaces across New York City. We have a great map online called the New York City Cool Options Finder. In the past, it was called the Cooling Center Finder, but now it has been updated to include a greater variety of options. So we have 3 types of spaces now, cooling centers, other indoor cool options, and now outdoor cool options as well. All of these places are free and open to the public, and they are available for anyone to go and get out of the heat. Next slide, please. So to go over the types of cool options, so for indoor cool options, and this includes cooling centers, these are indoor air-conditioned spaces, free, open to the public. We do have pet-friendly options and also accessible options. For options that aren't pet-friendly, remember that service animals are always allowed, whether the space is pet-friendly or not. These are safe, trusted places in the community that usually have regular programming also. There's a variety of options, as you can see on the slide. It's mostly libraries and older adult centers that you're familiar with, but we also have community centers, places like Petco, a couple of museums that participate. So definitely when you have a chance, before the summer comes, go on the Cool Options Finder and look at what's available. Next slide, please. And now for this year also, we're adding outdoor cool options. So the Cool Options Finder will be a one-stop shop, not just for indoor spaces, but also outdoor. So we have over 700 spray showers and sprinklers in public parks throughout the city that will be on the map, as well as over 90 outdoor public pools that are free and open during the summer. So how do operations change during heat emergencies, right? So the Cool Options Finder is available all year round. You can go on right now and look at what's available. So libraries, older adult centers, those places are open when cooling centers are not activated. However, when New York City Emergency Management activates our heat emergency plan, which is when there's a heat index of 95 degrees Fahrenheit for 2 days or 100 degrees Fahrenheit for 1 day, that's when cooling centers are activated. The vast majority of our indoor options are cooling centers. These are affiliated with New York City Emergency Management, and they will show real-time updated hours on the Cool Options Finder during these heat emergencies. Other options, such as the outdoor options, won't update in real time during these heat emergencies. However, you can always call 311 or visit the park's website to get updated hours for spray showers and public pools, because during those heat emergencies, sometimes they may extend hours for pools. All right, and again, I just want to reiterate, do not wait. The Cool Options Finder is available all year round now. I recommend going on before an emergency comes. Pick a few places that are local to you so that you have options when the day comes. If you don't have or don't use an air conditioner at home, you do need to make a plan for when it is dangerously hot. If you don't want to visit one of the options on our site, or for whatever reason you cannot visit one of these options, still think of a cool place that you can go, whether that's a family member or friend's home, a local business like a cafe or a mall, or if you're affiliated with a house of worship that you go to or a community organization that has space, check and see if those places are available. All right, and I think I'm passing it back over to Jill now. Thank you all.
Thanks, Jocelyn. I love that you said make a plan. We love plans at emergency management. It aligns with our Ready New York program. So we're going to wrap up and give you some reminders. The most effective prevention measures: air conditioning. Set your air conditioning to 78 or low cool or econo mode to be comfortable, save money, and conserve electricity. Drink, drink, drink. Hydration is critical. Know the signs of heat exhaustion or heat illness. Kat went into great detail, and that's really a great tip to pass on to your friends and family. Wear loose, light-colored clothing, and visit Beat the Heat often, and recommend it and send it to your community. So some indoor safety tips. I'm not going to read everything on the slide because I'm only going to read something that wasn't covered, right? So if you go down to using an electric medical device, so if you use something that's important for your health, you need to make a plan in case of a power outage. Register the device with your utility company, and that allows them to give you a special alert if there's something happening. So this is really an important point. Make sure you have backup batteries or extra equipment, like if you use oxygen tanks if you need them. And of course, we're going to tell you to sign up for Notify NYC. I'm going to give you more information on the next couple of slides. We covered most of this. What we didn't cover on this slide of an outdoor safety tip is the last bullet, to use a spray cap. If you're going to open the hydrant on your street, you can get that at your local firehouse, anybody over 18, and it will save thousands of gallons of water. I think the number is per minute. So this is something that you will also help keep your neighborhood safe. Staying safe and connected, we have a lot of mechanisms how we share information. Notify NYC, I'm going to give you an update on the next slide. The advanced warning system, if you provide healthcare, home care, etc., you want to definitely sign up for that. It gives the weather forecast information and very detailed messaging so that you could break it down and send it on to clients, staff, and your workers. Of course, through the Community Preparedness Program, as well as through our social media feeds. Now, focusing on Notify, we have a big new update. That's the main message I have, besides signing up online, is that you can do it on text by texting Notify NYC to 692-692. You'll get the citywide SMS text alerts. And the new thing is, if when you're prompted, you provide your zip code and you'll get neighborhood-based text alerts. So that's a great new innovation, which we thank our Notify team and OTI for brokering. And now I hope that we do have enough time for some questions. So Sanasa, if you can help with reading the questions, and I'm going to stop sharing my screen. But if you do
Okay.
want to email us, just note that you can reach us at communityprep@oem.nyc.gov. Once again, you'll be getting a Word document with all the resources listed. You'll get a copy of the slide deck as well as a copy of the recording. So give us a day or two and we'll get that out to you.
Jill, there are two questions in the Q&A. The first one is for residents with limited income who may have AC but don't want to spend the money on utilities. Do you have any messaging around that or suggestions for them to offset the cost in other ways?
Con Ed, would you be able to, I mean, that was a little bit of a review of some of the slide deck, but there's not really a specific program for that, if I am
Yeah, I can
understanding.
jump in with that. So the first thing I would say is to, well, first you check our website for Energy Affordability Program, or EAP. And also you can see all the programs that make you eligible. For example, HEAP, which is one of them. SNAP. There's a lot of programs that you could be eligible for that discount. So the discount from Con Edison is only from EAP. That's the only discounted program that we have. The other would Kalila had mentioned it. It's called an Energy Share Grant. Excuse me. You could either check their website. It's through HeartShare, and you can get $300 annually. So if you get it one year, you could also apply the next year as well. So from Con Edison's end, those are two great programs. But also, you should see what else you're eligible for. You may be eligible for other grants, Catholic charities. There's a lot of organizations you can apply for as well when it comes to utilities.
Thank you. Is there another question, Sanasa?
Yes, there was another question related to, it says, can you apply for the cooling program if you live in a co-op?
I will pass that. So I'm assuming that they're talking about the cooling assistance program. I will pass that on to HRA, but I will encourage you to visit the Access HRA website. When you scroll down on the page, you're going to see a schedule of income. So I don't think it's really by your income. If you're already receiving HRA benefits, you should be eligible depending on your income. So again, that's what folks will have to go to, but I'll double check on that. Thanks, Sanasa. The next question.
Yes. Could we share these slides on social media to inform people?
Oh, yes. Absolutely. You can share, and you can even parse out the information. So the other thing we encourage you to do is look to our social media, because we are putting out fantastic content. We've started already to put out Beat the Heat content. We'll have fun little memes and short reels that you'll be able to send on to use. And right now, like, I'm thinking about the Con Ed tips that Paul and Kalila shared. I want to share that with my neighbors. You don't have to share everything all at once. That might be a little too overwhelming, because what we've provided here is so important. But start to think about, which of the groups that you work with in your community might need to hear what is heat exhaustion, what is heat illness. And I do want to just share quickly I'm keeping my eye on the time, a brief anecdote, because I've done and listened to these webinars over the years. And when the pandemic came, I loved what Kat said, especially about it doesn't have to be 90 degrees, right? You can start to feel the beginning of heat exhaustion when it's under 90. And that happened to me. But because I'd heard that nausea was a sign, and to get into air conditioning, I hot-tailed it over to my local Key Food, was still about a 20-minute walk from my house, and just stayed in there in the air conditioning. Walked 12 minutes, had to go into another place. So Kat really gave you a lot of solid information. And I think also the slide that showed you what kind of people might be susceptible. And, it's really a range of health conditions that make us more susceptible to heat exhaustion and the heat illness. So you could just send it on, to your friends and family. Like, I don't know if this applies to you, but just so you know, if you start feeling sick, if you're outdoors, get into AC. So that's the strongest message that we have is AC save lives. Heat cooling assistance program will also save lives. Think about who doesn't have this information, right? It's not who has it, who doesn't have this information that you're connected to. Is it your house of worship? Is it your community organization? Is it, a fraternal sororal organization? Is it your buddies at your Mahjong club? Whatever it is, they need this information. So we really thank you, because we know you're here. You want the information, you want good, solid information, and you want to share it with your communities. Also want to give a shout out to our CERT volunteers, because they're going to be getting a special deck to pass on heat information to their neighborhoods. So thank you for attending, for those of you who are on today. Thank you for our presenters and for my co-hosts, and you'll be getting an email from us soon. Thanks, everyone.
Thank you, Jill. Thanks, everyone.